difference in my area. At that time I worked on a 25-bed cardiology ward, so with 16 monitored beds, and our staffing wasn't great. For an afternoon shift, we'd have 5 nurses on for 25 patients.
I can say that it has made a massive difference on our ward. Without overstating things, I think the patients that we care for on our ward are amongst the sickest in the hospital outside of ICU. And I can honestly say that I don't know how we cared for them prior to the introduction of ratios.
No, look, it made a big difference, really big difference, just in the little things. You sort of, being on a busy surgical ward, it's very easy to become task oriented. You sort of just got to do your jobs and get through. The ratios have allowed us not to have to worry about that so much. We're able to sit and talk with our patients a bit more, and you're able to find out a whole bunch more of what's going on with them.
The notion of sitting down and actually even having a 5-minute conversation with the patient was ridiculous, because you were so busy making sure everybody had their medications that you couldn't do that. Gaining ratios was not an easy task. It was one that required a lot of work, a lot of dedication, and a willingness to go the hard yards. I mean, we got to the point where beds were being closed, and that is never an easy decision for any nurse to make.
So there was a lot of interest in the campaign, because it was such a big a goal that we set ourselves that we ended up achieving.
There's a lot of workplace stuff that we were involved in. We'd sent photos, decorated our desks, signed petitions.
Well, I mean, a campaign like this, it's vital for everybody to get involved, and the biggest thing, I think, for a lot of nurses is keeping informed, reading the emails, coming to your branch meetings and just finding out what's happening.
Getting involved in letter writing to your local papers, maybe talking to your MPs.
And the other thing that country hospitals can do is really get their community on side, which is not something that readily happens in the city, but I think the nature of smaller areas means that the community can really get in, and the combination of getting the community and plus continuing to pressure the MP should get some movement.
My message to country and rural and regional delegates is that this is something that's worth fighting for. There is no reason why you don't deserve to have nurse-to-patient ratios of 1:4. Your patients are our patients. Just because you are not in a metropolitan area doesn't mean that you shouldn't have a workforce that enables you to provide safe patient care and also gives you a reasonable workload. I would so strongly encourage you to keep fighting for this, because I think that not only will it benefit you, it will be of such benefit to your patients, and I believe that the people of New South Wales deserve it.
Our message from all the nurses at Royal North Shore is fight for your ratios. They've made such a difference to us. They're great for safe patient care, they're great for the staff, and we need them everywhere. They need to be equal, and every patient deserves the right for equal care, no matter of what their postcode is.
Ratios put patient safety first.